So cruciform suture, it is formed by intermaxillary, interpalatine and palatomaxillary suture. There is a groove which extends from the greater palatine foramina through the incisive canal. Now we'll see the middle part of the basalis. The middle part again will be divided into median region and the lateral region. In the median region, you can see this bone. It is the vomer bone which separates the posterior nasal apertures. It separates the two posterior nasal aperture. In the upper part, it divides into the two alas, and there is a broad bar of bone which is formed by the body of the sphenoid and the base-occiput. In the middle of that, there is a tubercle. It is known as the pharyngeal tubercle. We'll see the lateral area. In the lateral area shows the two parts of the sphenoid bone, that is the pterygoid part and the greater wing of the sphenoid bone. Also, there are three parts of the temporal bone, that is the petrosal part and the tympanic plate and the squamous part of the temporal bone. Now we'll see the pterygoid plate. There are two pterygoid plates, that is the medial pterygoid plate and the lateral pterygoid plate. So each pterygoid plate, there is anteriorly it is attached and the posteriorly it is free border, and there is two surfaces, medial surface and the lateral surface. And if you see the medial pterygoid plates, at the lower end of the medial pterygoid plate over the posterior border, there is a process known as the pterygoid hamulus, and the fossa between the two pterygoid plates, it is known as the pterygoid fossa, and the upper end of the posterior border of this medial pterygoid, there is a small fossa, it is known as the scaphoid fossa. Now the lateral pterygoid, again it consists of the medial surface and the lateral surface. On the medial surface, there is the medial pterygoid muscle attached. On the lateral surface, there is the lateral pterygoid muscle attaches. Now we'll see the greater wing of the sphenoid. Now we'll see the infratemporal surface of the greater wing of the sphenoid. Infratemporal surface of the sphenoid. So now we'll see it is pentagonal in shape. Anteriorly it is formed, forms the posterior border of infraorbital fissure, and the anterior medially it continues with the pterygoid fissure, pterygoid process. Anterior medially it continues with the pterygoid process, and anterior laterally it forms the infratemporal crest. Posterior laterally it is joins with the squamous part of temporal bone. Posterior medially it articulates with the petrosal part of temporal bone. Now the foraminas in the infratemporal surface of the sphenoid, we can see the three foraminas. The first one, this is foramen magnum. Just behind the foramen magnum there is, or posterior lateral to the foramen magnum, this is the foramen spinosum. And in between the foramen magnum and the scaphoid fossa, there is another foramen, it is known as the foramen basalis. In between the foramen ovale and the spinosum, there is another small foramina, you may or may not see, that is known as the canaliculus innominatus. Just posterior lateral to the foramen spinosum, there is the spine, it is known as the spine of the sphenoid. Then this region, it is known as the sulcus tubae, that is the groove between the posterior medial margin of the greater wing of the sphenoid and the petrosal bone. So this is known as sulcus tubae, that is between the posterior medial part of the greater wing of the sphenoid and the petrosal part. This is known as the sulcus tubae, where the cartilaginous part of the auditory tube is situated. Now we'll see the petrosal part, or the inferior surface of the petrosal part. It consists of an apex and a base. Near to the apex, the foramina, it is known as the foramen lacerum, and the base, it is perforated by the carotid canal. So here it is the carotid canal, the foramen lacerum. Now the tympanic plate, or the tympanic part of the temporal bone, this forms, it's also known as the tympanic plate. It forms the posterior articular part of the mastoid foramen, the mandibular foramen, and the anterior part, this is the squamous part of the temporal bone, which forms the anterior part of the mandibular foramen. It takes part in the TM joint. Now we'll see the posterior part of the foramen Norma basalis, the posterior part. In the median region, you can see the foramen. It is known as the foramen magnum. Then posterior to the foramen magnum, there is the external occipital crest, external occipital protuberance, superior nuchal line. In the lateral region of the posterior part, it consists of the condyles or the condylar part of the occipital bone and the squamous part of the occipital bone. In the condylar part, you can see the condyles. So the two condyles which is articulated with the first cervical vertebra to form the atlantoaxial joint. On lateral to the in front of the condyle, there is the another foramen. It is known as the hypoglossal foramen or the anterior condylar foramina. Posterior to the condyle, there is the another foramen. It is known as the posterior condylar foramina. Then lateral to that, there is the another foramen. It is known as the jugular foramen and the jugular fossa. Jugular fossa and the jugular foramen. Then posterior lateral to the jugular foramen, this part here, it is the broken styloid process, and this is the mastoid process. In between the mastoid process and the styloid process, this foramen, it is known as stylomastoid foramina. So this foramen, it is stylomastoid foramina, jugular foramina, anterior condylar foramina or the hypoglossal foramina. Posteriorly, this is the posterior condylar foramina. Now we'll see the structure passing through each foraminus. The incisive foramen, which passes the greater palatine vessels and the nasopalatine nerve. Now the greater palatine foramen, which passes through the greater palatine foramen, it is anterior palatine nerve and the greater palatine vessels. Through the lesser palatine foramen, it is the middle and the posterior palatine nerves. Now, the foramen ovale transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and the emissary veins. Then the next is foramen spinosum. Foramen spinosum, through the foramen spinosum, the meningeal artery, meningeal branch of mandibular nerve, or also known as the nervus spinosus, and the posterior trunk of middle meningeal vein. So then the next one is the foramen lacerum. The structure passing through the foramen lacerum are during the life, the lower part of the foramen lacerum is filled with the cartilage, and so no significant structure passing through the whole length of the canal except for the meningeal branch of ascending pharyngeal artery. However, the upper part of the foramen is traversed by the internal carotid artery with the venous and the sympathetic plexus. Now we'll see the foramen magnum. So the foramen magnum transfers through the narrow anterior part, apical ligament of dens, vertical band of cruciate ligament, and membrana tectoria. Through the wider posterior part, the lowest part of the medulla oblongata and the three meninges. Through the subarachnoid space, 9 structures passes, that is spinal accessory nerve, 2 spinal accessory nerve, 2 vertebral arteries, sympathetic plexus around the vertebral arteries, 2 posterior artery and 1 anterior spinal artery. 2 posterior spinal artery and 1 anterior spinal artery. Through the hypoglossal foramen, through the hypoglossal foramen, the 2 structures, that is hypoglossal nerve and meningeal branch of ascending pharyngeal artery. Now we'll see the jugular foramen. So the jugular foramen, it is divided into 3 parts. Through the anterior part, inferior petrosal sinus, meningeal branch of ascending pharyngeal artery. Through the middle part, 9, 10, 11 cranial nerves, and through the posterior part, internal jugular vein and meningeal branch of occipital artery. And the last one, stylomastoid foramen. Through the stylomastoid foramen, facial nerve and the stylomastoid branch of posterior auricular artery. Thank you.